Both prostate cancer and prostate enlargement strike far more men than is a consequence of menstrual migraine. It can hit a young man and set in motion a deadly pattern that can remain throughout his life. Professional urologists estimate that 4 out of every 100 men who visit a doctor about fertility difficulties, urinary difficulties, prostate disease, the urethra, testicles, bladder, or kidneys are affected by one of these conditions. Prostate cancer does not pose a genuine threat to health, and further research on treatment is typically unavailable. Drug companies are unable to fund studies that do not provide beneficial outcomes. The symptoms of prostatitis are often a strong urge to urinate, trouble starting, dribbling, nighttime trips to the bathroom, fever, decreased libido or impotence, painful ejaculation, lower back pain, and perineal pain. In contrast to prostate glands, prostatitis symptoms differ vastly in severity. Many men will describe a man with prostatitis symptoms as a prostate cripple. A man with the symptoms described above is diagnosed with acute prostatitis, and bacterial effusion usually afflicts young men. Treating pain with physical medical techniques and examinations may fail to identify the cause of the discomfort. Examiners and urine cultures before and after a prostate massage can help differentiate prostatitis caused by infection from prostatitis for other reasons. Acute bacterial prostatitis is regarded as one of the more widespread bacterial infections in the body. It is characteristic of other infections in the body, but it's localized to the prostate. Since the prostate afflicted by the infection has an influence on the lower area, a man may experience pain below the waist, all the way down to the buttocks and groin, insertion of urine, incomplete urination, inability to pee, or total inability to urinate. My ex-cancer diagnosis uniquely qualifies me to comment on the painful circumstances a man encounters when he cannot void his urine. Prostatitis caused by bacteria is identical to any other type of infection. Bacteria enter the body unless the body can overcome the threat and settles in the prostate. The disorder may have originated via urethra through the urinary tract, or it may have been spread by an infection from one location in the body to the next via the bloodstream. To correctly diagnose acute bacterial prostatitis, doctors will thoroughly examine the patient and observe symptoms, inserting a tongue probe into the man's rectum to probe the prostate to retrieve prostate fluid. The doctor can massage the prostate to bring the juice from the prostatic head to the urethra and out the tip of the penis. Phytopathogenic assessment of the prostate fluid can be performed to test for pathogens. Doctors must be careful not to devote too much of their focus to a specific organ or symptom as opposed to the cause of the infection. The prostate is situated in the prostate axis of one of the 5 evacuation organs related to optimum health and fitness. Infection can result from poor elimination of the urinary system. Matthew, the video creator, is an 83-year-old cancer and stroke survivor who received his Ph.D. at 65. Would like you to know his passion for helping others by spreading good health information. Please help by taking a moment to subscribe and like this video.